Good morning, Dr. Stamatopoulos. Thank you so much for joining us.
Good morning, Tammie.
We'll start off, this week we learned about a 94-year-old woman in a Whitby long-term care home who died as a result of an interaction with a resident. Homicide investigators are looking into this, and that is actually the third since early December. Your thoughts on seeing this recent spike? I know we can't speak directly to these incidents and the details there. They're under investigation, but in general terms, your thoughts on the spike?
I mean, we should be very concerned about this. We have a 2019 report that showed that over the preceding 6 years, there were 29 homicides in long-term care. We've seen 3 in the last 2 months. If we're going to carry along at this rate, we could see upwards of 12 to 18 resident-to-resident homicides in long-term care in a year alone. I mean, I don't think people realize this level of violence is virtually untouched. There is no comparison. When you look at the data and you look at the proportionality of the homicide rate compared to, let's say, Toronto per 1,000 person, I mean, the long-term care homicide rate is 4 times greater than the city of Toronto. This is a massive problem that our elected officials seemingly don't want to talk about and have not said a word about over the past couple months when these homicides have been escalating.
And we have reached out to the Ministry of Long-Term Care. I did that yesterday, and they did provide a statement, and I'll read it in part here. It says, while all loss of life is a tragedy, death from homicide in long-term care remains rare. In 2023, 3 deaths from homicide occurred in an Ontario long-term care home, and that's according to the Chief Coroner's Office. And then just to further down the line here, they say that to assist residents with complex needs, such as dementia, Ontario has invested an additional $15 million through the Local Priorities Fund. When you hear that, the fact that these homicides are considered to be rare, but then we're seeing that, as you said, from 2019 and the 6 years before that, we had 30 deaths in long-term care homes, and we're seeing this recent spike as well.
Yeah, I'm sorry. Give me a break. You look at the data, and there is nowhere greater where we have a higher homicide rate. So I don't know how you can say that with a straight face, that this isn't a massive problem that we should be, ringing the alarm bells on. We know that, especially during the pandemic, and frankly, over the last 5 years, we have seen the care needs of these residents increase for many reasons, particularly the consequences of COVID. And many of these residents have had repeated infections, right, and are dealing with long COVID or dealing with other disabilities and comorbidities. And not only that, but we've also seen during this time that the care levels have actually gone down. When you look at the research that exists in the homicides, people that have looked at this, right, most of these incidents have been documented as not witnessed by staff. Most of them also occur in the evenings when we know staffing is lowest. Frankly, the solution is very clear to me. This all boils down to the chronic and dangerously low levels of staffing in these facilities and persistent low training to deal with dementia and things like sundowning, which conveniently are occurring at the same time that we are seeing the increases of these incidents of abuse.
So do you think then the solution here, at least something to help stem this, if it's being called a crisis, as it has in the past by even the coroner's office, is having more staff, especially again during those times when patients with dementia will be more active, let's say in the evening?
Yeah. There's no question about it. The solution is as clear as day. And the thing that frustrates me and most advocates is that we had a press conference by our long-term care minister last week. We very rarely hear from him. And he was boasting about, throwing $72 million at an 10-person elite inspection team. To tell you what you already know, Minister Cho, that we've heard from every commission, public inquiry, your own staffing study that released in 2020 under previous Minister Fullerton, that all of this, the vast majority of the injury, the neglect, now the homicides, results from these chronically low care levels that this government refuses to properly mandate in this facility. This is persistent underinvestment and the evidence of low staffing levels. The conditions of care become the conditions, the conditions of work become the conditions of care in any healthcare facility. And we have some of the lowest staffing levels in long-term care. That hasn't been changing even after everything we saw happened in long-term care. Fix the staffing issue. Take the money and put it all towards hiring full-time, properly qualified and trained staff that will stay in these jobs and prevent the revolving door that remains in this sector. And we'll see the homicides drastically decrease.
All right, Dr. Vivian Stamatopoulos, thank you so much for joining us here this morning. I really do appreciate it.